Welcome to the Qualified Medicare Beneficiary, or QMB, webinar. This webinar is designed to cover the program and the information that we have available to you. I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter. Today, I'm joined by Mary Sue Gardner from my team. She's going to monitor that chat, put some information in there for you. She's going to ask me any questions that you put in there. This webinar is designed for those who are wishing to learn more about Medicare and Medicaid. This webinar only focuses on one portion of Medicare and Medicaid, however. Keep in mind, this is not about Medicare Advantage plans. We won't be covering anything Part C or Medicare Advantage plan related. This is about traditional fee-for-service Medicare, and that is Part A and B. Let's get started with just a little housekeeping. If you would like to download the presentation, you can go to our training center. In the training center, you're going to go to live events. Inside live events, you'll be able to find this event, and then at the end, select the training material, which will get you the presentation. We will list all of our upcoming events there and the materials that go with them, typically about 5 days before the event. Once the event occurs, so either later today or tomorrow, this event will be removed from live event. Don't despair if you didn't grab that presentation or you want to grab the presentation material. However, you do need to wait. It's typically 1 to 2 weeks. And what we will do is post it in Encore presentations, and then you can download the presentation from there. So it is still going to be available for you. We do keep them available for 60 to 90 days, and it just depends on how many we have out there. For this event, I will take any questions in the chat. What we will do is stop at periodic times to answer those questions. You can then submit follow-up questions, and we'll talk more about that after the event. We will also ask you to take a survey a little bit later on, and the survey is to help us gauge the event, what you liked, what you didn't like, what we could do better, all of those types of things. The information is used by WPS and CMS to help improve the Medicare program and the trainings that we offer. A couple of things to keep in mind. This material is a tool to assist the provider community. If something changed in the time that this material has been written, I did try to verify that was up to date earlier today, but if something has changed, it is your responsibility to watch that change, to check for those changes, and to make sure that the information is accurate. Any answer that we give is going to be relied on the facts that are given within the information. Now, I put that in there because some of the questions really were interesting to me in order to try to help you understand the QMB program. So for instance, one question came in and they are saying VA, which this has nothing to do with Veterans Affairs. So Medicare QMB program doesn't have anything to do with that. It's the Qualified Medicare Beneficiary program, nothing to do with that. So those are what we're going to look at when we talk about some of those facts given. You can access the most current information on the CMS website. That is where the current rules and regulations will fall. What are we here to do? Again, to help you understand the QMB program. This information was presented back in January. However, there was a flaw in the recording, so I couldn't post it or do anything with it. So we're redoing it again. So in order to help you understand the QMB program, first, I do want to talk a little bit about the QMB program, give you some basic explanations. We do want to provide you with some resources, and last we're going to end with a Q&A session. Now, the Q&A session will focus on a variety of different things, which does include the pre-submitted questions and then moving to the live questions. So again, that's why it's really important that you use that chat feature so that we can track everything as they come up. The first basic thing we need to do is to say, what is QMB? Who qualifies for it? Why is it important? Okay. Also, we're going to talk about this applying to a Medicaid patient and how do we work with Medicaid. And then last, what is QMB? Why does it work? What do we do with it? What is the goal of it? And for the person that did give me a cute comment that said it's to annoy you, pretty sure that wasn't Medicare's intention. I'm not saying it doesn't do that. I'm just saying it probably wasn't the intention of the program. So again, QMB is the first thing you must understand, and that's Qualified Medicare Beneficiary, QMB. I will use that acronym a lot. What do you have to know about the patient? So who's eligible for the QMB program? The very, very key point, the very important thing is, one, they have to be Medicare and Medicaid eligible, Medis. This is a dual eligible patient. The person cannot choose a Part C plan and have a QMB program. It doesn't work that way. So again, that's why we're not talking about Part C, which is Medicare Advantage. So they have to be dual eligible for Medicare and Medicaid. Also, along with that, they cannot be on a Part C program. If they've chosen a Part C program, it does not work for them. However, this is a Medicare savings program, which means that it will help by Medicaid paying for the Part A and B premiums, deductibles, co-insurances, and copays. So the goal is to help the patients pay for the Medicare liabilities, which can include their Part A and B premiums. One of the questions I got in, I think they saw this slide and were thrown off a little bit, and they said Medicare Part A doesn't have premiums. Well, that's not necessarily true. Medicare Part A does have a premium-based program if you have not worked 40 quarters in a lifetime. That's the equivalent of 10 years, but it is not 10 years. It's 40 quarters. If you've worked 40 quarters in a lifetime, then yes, Medicare Part A is premium free to you. That's, the majority of the patients on Medicare, the majority of the people you're going to see. However, if you haven't, you have the option to purchase it, just like Part B. And purchasing it means you pay your monthly premium, you still pay your deductibles and your copays. So that's where it comes from. Yes, you can purchase Part A and Part B, but most people will have Part A for free. If at any time you stop paying your premiums, you cannot be eligible for the QMB program. You have to have both Part A and B. So can someone actually elect or say, I want to be part of the QMB program and this is how this is going to work? And the answer is no. It's actually eligibility based on the state assistance program or state Medicaid agency, meaning a patient must meet specific criteria to automatically qualify and they can't choose to enroll in it in most cases. Now, some states will say, hey, QMB, we can disenroll, right? So that's going to be a little bit different. So we want to make sure that you are aware of what's going on. Also, Medicaid is responsible for indicating which of the Medicaid programs they have. So QMB is one thing. There may be other state agencies that have different programs, and this has been a big issue. It is Medicaid's job to indicate that to the Social Security Administration, and the Social Security Administration can track it from there. Now, some Medicaid agencies will say the patient has to contact 1-800-MEDICARE. We, as your Medicare administrative contractor, are not involved in that process of updating in any way, shape, or form. So we don't have any offered guidance on it. What we do know is CMS typically tells us that Medicaid needs to fix it, needs to adjust it, needs to put in an end date and a start date. So we don't really know where that goes. All right, so remember, this goes through the eligibility system. That's what it is. Patients who are eligible go through the eligibility system. Why is that important? The eligibility system is controlled by the Social Security Administration and is updated accordingly from the Medicaid system, which is also then fed into the Social Security Administration. So hopefully I got all that together on how you determine eligibility and how you can identify a patient. Now, a little bit more about identifying a patient will be in the resource section, because we're going to talk about on our website the area that you would use to identify a patient. Billing. So first, you must bill for Part B covered services and you must accept assignment. This means that if you bill on a 1500 claim form or an 837P electronic transaction, you have to accept assignment. The reason that we don't include the UB04 or the 837I, they always accept assignment. It's part of their participation agreement with Medicare. So it's not an option for them to say accept not on this claim. If you bill and you do not accept assignment, then these amounts are then billed to Medicaid for processing. Once Medicaid processes the claim, you have to follow whatever liability they give. I think I just said if you do not accept assignment. When you do accept assignment, which is a requirement, then these claims are automatically sent to Medicaid and Medicaid processes them. Once Medicaid processes the claim, they assign the final patient liability. So Medicare does give a liability, but then it's billed to Medicaid, who does their processing, and you must follow their guidelines. For those of you that are wondering where this information comes from and how this process works, please check out the Medicare Claims Processing Manual, Chapter 1, General Billing Requirements, Section 220. Okay, please check out that one. All right, so what do we know a little bit more about identifying patients? Please stop and identify your patients before you bill Medicare. The reason that we ask that you stop and identify the patients is that you must bill accurately the first time and you must bill in the correct order. So a qualified Medicare beneficiary patient, a qualified Medicare beneficiary person can have a primary insurance before Medicare. And let me give you an example of that. Yes, they have a car accident and therefore that car accident has liability insurance. Got that? Liability insurance. So once they do that, what we have to do is say, okay, the liability still has to pay before Medicare can consider it. Medicare will consider it before Medicaid can consider it. So therefore, you got to follow all the steps. Does that make sense? You need to identify your patients, but you also need to identify who comes first. And this is done in your eligibility check. Your eligibility check offers 3 different options: the Secure Net Access Portal, or SNAP, sometimes also referred to as just the portal. This is on the WPS website, wpsgha.com. It's the secure section. It's where you log in. It's where you have an eligibility check. This uses the 270, 271 HIPAA eligibility transaction to receive the information. 270 says it goes out, checks the common working file. 271 is the response from the common working file back to our system. It's just a standard HIPAA eligibility transaction. You also have direct data entry. Now, this is a limited system because it is not for everyone. You have to bill on a UB04 or 837I, and you have to do inpatient or outpatient facility billing, which bills then into the physical intermediary standard system. The FIS system is what DDE actually accesses, why it's not available for everyone. SNAP, or the portal, is available for anyone that bills WPS. You can get access to it. DDE is not. Last, you can actually complete the HIPAA eligibility transactions. These are the 270, 271. This is the exact same transaction that we use and we give you access to in SNAP. But if you want to do it differently and on your own, you can check out CMS and they will give you some information on that. Type HETS, H-E-T-S, HIPAA Eligibility Transaction System. So that's where you want to go, and you want to make sure that you get all those different pieces of information. I do want to remind you that I'm going to show you a couple pieces of this in just a little while. But you do need to take the time to identify the patient. You do need to take the time to identify if someone's supposed to pay before Medicare as well. That's one question we got is, does Medicare secondary payer still apply? And the answer is absolutely. This is where some of the confusion comes in. For services that Medicare and Medicaid cover, there is no patient cost share. This is from the Social Security the Social Security law, and it's section 1902NB. So this says I lost my place. Okay. In the case in which the state payment for Medicare cost sharing for a qualified Medicare beneficiary with respect to an item or service is reduced or eliminated through the application of paragraph 2, which then further goes on to explain. So if you're reading that, you're looking for 1902N3. Okay, and you want to make sure that you're reading through this information. Now, again, this does come directly out of the Social Security Act. This isn't something that we get to interpret or that even CMS gets to interpret. It's right there. It does go on to say that in B, the beneficiary shall not have any legal liability to make payment to a provider or to an organization described. And then it gives a section of the law that describes organizations for services. So that means that if they have the Qualified Medicare Beneficiary Program, the patient has no liability, but it has to be something that both cover. And we'll talk more about that in just a few moments. But so hopefully that all makes sense. Now that does mean while we may give you a liability on your remittance advice remarks code, that's okay. Here's the catch with that. It still hasn't gone to Medicaid. Now someone said, but don't collect the amount. Why are you giving us? Because we still have to apply to deductible, right? We still have to apply to co-insurance. That's what the remarks codes are saying. What the adjustment is saying is don't collect this amount. Instead, bill Medicaid because they're a QMB patient. So you can see, yes, there's a patient responsibility. Yes, there's an adjustment saying, hey, don't do that, don't bill yet. But then we do want to explain that it is deductible and co-insurance. So when we really look at the remittance advice remarks codes and the remittance advice reason codes, there is a way in which you can identify that. And it's very specific, and you want to make sure you follow that. I was asked specifically for those codes, which is what this slide was designed to do. So if you need more on those slides, please feel free to drop that in. One thing that I would like to take just a moment to help you all out with is in the Social Security Act, and I want to look up section 1902, and I'm actually going to show you how to find this. So when we come out to this particular website, it doesn't matter which one you're on, I'm going to tell you the first thing I would like to do is to start off with saying, hey, let's go ahead and open up, but let's just Google, straight Google. You can use any search engine you want. Here's the section I want, and I'm just going to put Social Security Act. Okay, so obviously I didn't spell security correctly. Good. But here's where we have the section 1902, which is what we're looking for. Then once we open it up, you get to read through all of this fun stuff. And remember, we said it's an N, so okay, must be A, B, 2, okay. And then you just got to find the right area. Not as easy as y'all think it is, but you just get to scroll through and read through the different areas. So hopefully that makes sense to you. Again, it is the Social Security Act. What I can do is put just the link, right? That's it, just the link. And that'll get you to the Social Security Act. Now, I will remind you that some of the questions and the information I'm giving you on the slides is because you ask questions. So you're saying, hey, I don't have this, but it is, oops, sorry, right here. If you have the slideshow and you say, oh, I want to check out this section of the Social Security Act, click section 1902. It's going to tell you want to look for N3B. Opens up and you want to scroll through until you find, here's A. You got to find N, you got to find 3, and you got to find B. Now, again, it's just a matter of scrolling through. So it's all there for you if you actually have the slides. That's why I keep recommending get the slides, right? Get the slides. So we want to make sure you're at least aware of it. So that's my first resource that I'd like you guys to take a look at and how you're going to use my slide deck if you want to. Let's talk a little bit more about some of these different resources because there's a lot of information out there that people tend to ignore or forgets there, or they're not sure how to find it, which I think is the more common situation. So before I get started, I do want to show you one resource that has given a lot of people some information, and it was something that we created recently, so it's not something that necessarily is going to be in your slide deck there. So again, if we created it, it's going to be on our website. Our website is wpsgha.com. A lot of people tell me they're not familiar with the training center. What they are familiar with is, oh, I can come in and find my live event and I can go down and say, oh, I want the webinar material. Okay. Or I can come in and go to the encore presentation portion and find and watch my videos later. Awesome. What you're missing is to scroll down to the bottom part down here and see this specialty service training and resources. Open it. By doing that, we have a variety of them available, which does include the Qualified Medicare Beneficiary program. What we did is put all of the links that we can find and everything I'm going to go through together in one spot for you. This will then help you understand, what are you looking for? So do I need general billing information? Am I looking for? And it'll actually tell you sections of the manuals and all of this different stuff that you need without having to dig it up. So that's a pretty useful resource that a lot of people have said once they got familiar with it, they're like, oh, we really like this, but they didn't even know it was there. So that's my first tip for you. It's one that isn't on your sheet that I didn't realize y'all didn't have. Again, it was one of the more recently added ones, so it's not something that was there and hasn't been there for a long period of time. So thought I'd just let you guys know about that. All right, let's jump back to our presentation here and see what we got going on. So the first thing you need to be aware of is that CMS also has a Qualified Medicare Beneficiary webpage. This is a CMS website. It is national information and it's available to you. Once again, you can navigate to it and that's fine, or you can simply use the link directly on the slide. When you open it, let's hope this opens, there we go. Sometimes it gets stuck and doesn't want to open for me, but in this case it did, and it'll walk you through everything we just went through. You know, hey, it's Part A and premiums cost sharing, right? It's telling us more than 8 million individuals or in the QMB program. Lots of good information to keep aware of. This is the section that I personally like a lot. It's information for Medicare providers and suppliers. One of my favorite things to do is to read through the, where is it? QMB program FAQ and billing requirements. I think this gives you just a lot of information. It's a PDF document. It's something you can look at, search through, try to get what you need. I know it's from 2018, but you know what? It really hasn't changed. So that means it's a great resource. If you're not familiar and you don't necessarily want to read through everything, use Control F, the control button and F on your keyboard. Search for whatever you think you might want to find. Let's just say Medicaid, and I know this is going to appear a lot, okay, because obviously it's the type of program, but it'll highlight the first hit and then it'll move you through each time it appears so that you don't have to necessarily read through everything. Now, it does then help you if you say Part A, Part B, coverage, all those different things, but this is information put together by CMS for national education. Okay, that's really great information. I do really like that one. Again, it's just on the CMS QMB website. It's just there for you to be able to find it. A couple of MLNs that I would take a minute to read through if you want to. Now, an MM article is what stands for Medicare Learning Network. MM is the abbreviation they use, and it just gives you the article and again a PDF. So you don't have to read through and try to find all this stuff. Just come to this page. Someone said, I'm not really sure where to find this page. You can search QMB. Okay. Search QMB. If you're a searcher, do that. Don't spend the time trying to navigate. If you're a navigator, you will come to Medicare. And if you scroll down, you're going to see Medicare, Medicaid coordination. And then if you come to the right side of the screen, you'll see in the middle, Medicare, a Qualified Medicare Beneficiary Program. And guess what? There you go. So I've given you a bunch of ways to get there. You can search for QMB. You can use my slide deck and just, select the link, take you right here. You could also navigate to it. But again, scroll through, take a look at the information. A lot of what I've given you is on here. One other area that is very nice is if you're trying to help someone understand the QMB program, scroll down below the provider information and look for this set of information. This set of information is something that can be given to beneficiaries and their advocates or people that are willing to help them. So we want to make sure it's all there for you. All right. What's next to talk about here? Oops. The Medicare dual eligible. This is one of those fact sheets that we talked about that I did show you on the other one, but I can just open it up for you again. What's great is this is not aimed for patients. Keep in mind, this is aimed for providers and their representatives. The reason that I brought you to this page is if they update the booklet, which they just did in 2024, but they could do it again. We want to make sure you can get to it. Otherwise, if I give you the actual PDF document, when they update it, it suddenly goes away. This page is where they give you access to it. So that's why I did that. But here's the booklet. You can read through a lot of the information. What's great about this is that it's going to give you high level, quick information. If you have someone that's new in your office, this might actually be a better place to start than someone that is familiar, kind of working with Medicare, etc. This might be what you need. So this booklet really does talk a little bit about the differences, what is dual eligible, QMB, and here's, where people talk about that specified low income Medicare beneficiaries, a different Medicaid program. We're not focusing on that today. We really are just focusing on this one. So you want to make sure that you are aware of all of these. So depending on the situation, it really does depend on information eligible and things that do happen, but I do want to focus just a little bit. Qualified Medicare beneficiaries only without other Medicaid, and it talks about benefit qualification. It talks about the benefits, the qualifications, and it's a really nice chart that will help you through these. So I do recommend taking a look at this chart. If there's a table or there's something else they want you to look at, it's actually going to link you right to it. Here's the table that you need. So feel free to take a look at all these different things. I do recommend, again, if you're just getting started, this one does help people really understand a little bit about Medicare, Medicaid, the fact that there are different programs, all of that type of information. One area I wanted to point out is this area in red. And the reason that this is important is anytime CMS makes major changes, this is what they're updating. You're going to find red and it'll be what they're changing. Now, again, the blue links are just because it is the link to something else or somewhere else, but the red is what actually changed. All right, so that's just another good opportunity, depending on what you're looking for, to get what you need. SNAP, the reason that we put this one in is that it is the Secure Net Access portal. It is our portal. And on our portal, I'm going to walk you through the steps to use the eligibility check. The eligibility check is key because that's where you're going to find the QMB information. So you want to make sure you're well aware of how to locate this piece of information. So let me just show you where this is located, and then we will jump back to the slide deck. Okay. Right here on the top, on any page, it says user login. It says user ID and password and login. This is actually the Secure Net Access portal, or SNAP, sometimes just referred to as the portal. This is where you're going to find that information. The interesting part about this is I can't access it. The screenshots I can give you, but I can't actually access it because there's too much protected health information and personally identifiable information for me to access this and have it be usable. However, we do have a portal user manual. And if you go through the portal user manual, you can scroll down and see all the different sections, getting set up, anything you need. What I want you to do is to be aware that if you go to the patient information and you go to the eligibility check, this is where you're going to find the QMB stuff. And we're just going to scroll down for a second here. So, oh, well, this one is highlighted gray, so it's not really going to help us. But if there's a blue and highlighted, like home health right above it, this is where you would find the QMB information. This will also explain to you what is available to you under each section. So if, again, if I'm just doing a fast scroll and I'm looking for that box around QMB, it will tell me what's there. Now, this is, again, that 270, 271 transaction. It's all the information we have available to us. We don't get extra information that you don't get. So we get an enrollment period. This is something that we don't update, okay? It's just literally a display for you. And it explains a little bit about that. All right. So with that said, let's jump back to the slide deck for just a second, because I do have some slides that I'd like to show you. First, you're going to do an eligibility check, and I kind of showed you through that, but you do need to make sure that you are highlighting and entering the correct information. One of the things I want you to be aware of, asterisk means it must be entered, except for this field, which has the two boxes and it says or in the middle. That means either enter the first name or the date of birth, but you don't need both. You do need the last name, all of these types of pieces of information. So again, Medicare number, all of that. Once you do that, you're going to hit search. It's going to move you to the eligibility and supplemental insurance screen. This is just the patient information you entered. We're going to look at eligibility. Because they are still eligible for Medicare, they just have Medicaid in addition. Again, you're looking for this QMB tab, and I don't have an example of it live. I do only have the grayed out examples, but what we do have is this, which is a mock-up or a fake patient with QMB. And so it'll tell you dual eligibility entitlement for qualified Medicare beneficiary. This is the date that they started with, and it goes to, which is currently open. And then here's the termination dates for whatever they had and the entitlement dates. Qualified Medicare beneficiary stuff. Now remember, it's broken out based in this manner because this is how the Medicare eligibility benefit system works. So you have so many days of deductible for Part A stays. Then you have lifetime reserve days after, you have certain hospital and SNF days. So when we look at all of that, this is based on the Medicare benefit, how much of that remains, and then how much of that was waived. So let's keep going. Before I get to this, I do have a couple questions and a couple things that I want to remind everyone. First, one of the questions that I got in was, my facility does not use your website. Where do I start? Well, I would need to know, first, do you use direct data entry? Because there is information on the eligibility check and direct data entry, so I'm not sure what your facility uses. Second, if you don't use it, go ahead and consider actually starting an account, and whether or not that's you or someone else can be an NPI administrator, and they can then control who can have access to stuff. So it really is important to check that eligibility information. Remember, CMS requires you to figure out who to bill first, and that's a primary payer, that's Medicare. Now, we always know Medicaid is second, but how is it billed second? Is it billed through the QMB program or one of the other programs that you might need to know? So I really would encourage you to do that. Um, let's see. Let's go through a few other common questions or questions that we have before we get started with any of the other questions. So remember, we talked about the CMS FAQs, and I did emphasize, take a look at these. They're really good information. I'm going to emphasize it again. If you don't want to have to track them down, I did provide a link and you can just select it and move on. Question 1. The first question we got was, how does a patient get to be a qualified Medicare beneficiary? And it is actually done through the Medicaid office determining the patient is eligible for QMB status and they meet their Medicaid requirements of QMB. It's not something the Medicare program does. Instead, the Medicaid program does that. Can a patient who has a spend down be a QMB? Spend down, it's a program allowing individuals with income above the Medicaid limit to become eligible for Medicaid by spending down the difference of the medical expenses. We do not determine this. Medicare instead turns to the state and says, are they eligible based on your information? Okay. Are they eligible based on your information? So that's when you're going to look in the system and see whether or not that eligibility check shows QMB. You're not a provider for Medicaid. Can we ask the patient to sign a waiver allowing us to collect Medicare deductible and coinsurance? And the answer is no. Remember, I cited that section of the Social Security Act. We actually showed you where to find it and all the information that you need. It doesn't state if you're a Medicare provider or not a Medicare provider. Instead, it states if the patient has the QMB program. So that means it's not an option. How often can a patient's QMB status change? This was one of my questions that we struggled a little bit with trying to figure it out. And the reason that we struggled is because we don't actually make these changes. This is done through Medicaid. So one of the things that was interesting in one of the statements is that it depends on their Medicaid status and also their income variations. So income variations, they were talking about things like, what if they get an inheritance? So for a period of time, they have too much money to be on Medicaid, but then that is spent, gone. So now they don't have that income. Could they go back? And the answer was yes. So it was very interesting. So our answer to you is you're going to have to go back to Medicaid and figure out how often this can change. Because each state has a little bit of different laws and rules and regulations that govern that. And unfortunately, it's not a Medicare governing thing. What we do is say, yes, within our system, they have QMB, therefore you can't bill the patient. So if the beneficiary isn't qualified for Medicaid, how do we initiate getting that updated? So I'm going to guess that this is currently on the file. And what that means by currently on the file is that it's on the eligibility file. So maybe the patient doesn't have Medicaid anymore. Maybe for whatever reason, they lost their Medicaid eligibility, their income levels went up, they adjusted things, they got married, whatever the situation is. So first, it's not something that Medicare can help you with. Now, Medicare being us, if the patient wants to update them, they do need to contact Social Security Administration and work with them to determine what needs to be done. The reason that the recommendation is the Social Security Administration is that some entities or some states use Medicaid and they have to go through Medicaid, and others can be done through Social Security because they don't have Medicaid. So it gets very confusing, and it is really a state-by-state answer, which has become part of the problem for the provider community and for us as well. We don't really know where to refer them to because it's not a direct yes or no, it's so and so, it's such and such. It doesn't work that way. So they can start with 1-800-Medicare. They can contact the state Social Security. They can contact their local Social Security, or they can contact state Medicaid. Try starting them on those 3 sources and hopefully one of them can get them through the process. Here's what we know. As a Medicare administrative contractor who processes claims, we cannot initiate getting this updated. We are in the same situation you are. We will process it stating with the hold for QMB liabilities that we talked about on the remittance advice, and that's what you get. Next, does a patient qualify for Part A and B if they are a QMB beneficiary? And the answer is yeah. You have to pay for Part A and B. It's part of the requirement for QMB. So if you're not doing that, then you wouldn't be able to do that. Now, there are other cost-saving programs or other things that work with Medicaid that are not QMB, which they could qualify for if they did not have Medicare Part A and B. But for the QMB program, the answer is yes, they have to have both Part A and B. Can the patient be a QMB and not have Medicaid coverage? And the answer is no. That's like the whole principle of QMB. That's what the Social Security states, is that they have to have this. So if they don't have Medicaid, no, they cannot. If the records are incorrect or need to be updated, again, refer back to the other answer that I gave, which is start with the Social Security Administration. That's their local office, 1-800-Medicare, or the state Medicaid agencies, and someone has to figure out how to update it, because you as the provider and I as a representative of the Medicare administrative contractor, neither one of us can do this. Is the QMB beneficiary responsible for the coinsurance and co-pays? For the most part, no. Now, we say for the most part because sometimes Medicaid will say, hey, this is the patient responsibility. It's not even a covered benefit. It's not anything. And so if they do that, then maybe they may be responsible. But again, it's not really the coinsurance or copay. It's when it's just nothing responsible. It's not even a Medicare benefit. It's not even a Medicaid benefit. It's just something completely the patient responsibility. And that does happen rarely, but it can happen. It's just not going to be something we can answer, because we'll process it as, hey, it's a QMB claim. The QMB claim then processes it as whatever they're going to do with it, which is the Medicaid processing. All right, so those are the start of the questions that we got in. Now, I do have a bunch more, but I do want to stop right here and go to the chat questions first. Then we'll come back and do some more pre-submitted questions. So Mary Sue, anything in chat?
Hi, Tom. Yeah, we do have a couple questions that came in chat. Some of them you've kind of maybe touched on, but I want to re-ask so you can clarify. All right. So as we start, if Medicare shows patient has QMB, but the state record only shows that they have the Special Low Income Medicare Beneficiary, or SLMB, how does Medicare get that updated?
So once again, here is going to be one of those interesting situations where it really is to go back to, and you may have to go back and figure out where the breakdown occurred, and not necessarily you, it may be the patient. Was it from Medicaid to the Social Security Administration? Was it at the Social Security Administration to the Medicare file? Or was it something else, which is 1-800-Medicare? So it's not quite as easy as this is how it's done and this is what happens. Some people have said, hey, just contact Medicaid and have them rerun it through the system and take that old one off. Look, that may work, but we don't necessarily know that that's where the breakdown occurred at. So there's a lot of investigating that needs to be done, and it can be done by you on behalf of the patient if they give you permission. But for the most part, the patient or someone from their family, some representative of them, will need to do that. Next question.
And the next question was a follow-up from the same asker, Kathy. And she had said, when you were talking about this earlier, she had heard what you'd said about the state notifying Medicare. Can we provide that information in writing so they can deal with their state Medicaid agencies, since they're trying to tell us that the patient has to update Medicare with this coverage change? So do you, is that something we can look up or you have available?
No, that was information given on from CMS. It's in the I want to say it's in the FAQ. But I can find that out. You got to let me dig it out, and I don't want to spend the time to have you all watch me dig it out, because I'm not sure exactly which section that came from. Here's what I can tell you: if the Medicaid agency is referring the patient, then you need to refer the patient to 1-800-Medicare. For the most part, though, it's not something that we in the Medicare system can change. Now, if 1-800-Medicare can do something different, it's a separate contractor. Again, it is not your Medicare administrative contractor. It is a separate contract, and maybe they have some control we don't know. CMS has not shared that with us. Again, we don't really have a reason to know that because it doesn't affect us and our job that we do. We just process it based on saying, yes, they have the QMB. Here's what you can do. So anything, Mary Sue, anything else?
Yeah. Okay, the next question is, are you able to explain why Medicaid will say inactive Medicaid, but states the beneficiary is QMB qualified? And the asker says, I'm asking because you stated that they have to have Medicare and Medicaid. Also, does QMB eligibility vary from month to month?
So our basic understanding is that yes, the QMB eligibility can vary from month to month. It's really up to the state and to their individual requirements. So I don't have the best answer for that. In terms of Medicaid stating the beneficiary doesn't have Medicaid but does have QMB, I guess what they're doing with that situation is saying that they do have a form of Medicaid. It's the QMB program. It's not necessarily all Medicaid. I don't know for sure. You will need to ask your state, what does this mean to you? And that becomes the biggest problem with some of the QMB issues is some of the states say, yes, they have Medicaid. Yes, they have QMB. Other states say, no, they don't have Medicaid for everything. We just have them in the QMB program, which is due to a restriction on income or something like that. It's not something Medicare, though, gets involved with. We don't have anything to do with it. It has to go back to the state, and the state then has to specify.
Perfect. And your next question is, can we bill the patient when the crossover claim failed and the patient did not supply their Medicaid information to submit the secondary claim and obtain Medicaid RA?
Okay, so I'm assuming this patient record still shows that they have Medicaid, in which case I would say no. And the reason I would say that is the Social Security Administration doesn't say when the crossover failed. It's still the provider's responsibility to get it billed somehow. I'm not sure what your state has as a Medicaid portal, similar to our portal that you could look information up in. I'm not sure what your state Medicaid rules are to say, hey, it's your responsibility for determining all of this, because remember, in Medicare world, if you determine that they have Medicare, it's your responsibility to get it billed to us, even if they don't supply you with the proper information, even if you have to dig around and get that information, it's still your job. So this one gets a little bit tricky because I'm not sure of exactly what your state regulations say. Next.
All right, and the next question comes in. How can I know whether Medicaid has paid a QMB patient's Part B deductible?
Well, it would still show that the deductible has been paid and applied within the Medicare, within our SNAP system. Would say that. Check the QMB area. That's what it's looking for there, is how much went to deductible and how much was sent to the QMB to be paid. So if you go back to that eligibility screen that I showed you, and it's the QMB eligibility screen, could be different from the regular eligibility screen, and that QMB didn't apply to all of it. So I'm not really sure exactly what you're looking for there. So maybe a bit more information if I didn't answer your question.
All right. And then the next question, if the Medicare eligibility shows under QMB, dual eligibility entitlement enrollment period from 12/1 of 24 to 3/31/25, does that mean the QMB ended on 3/31/25?
It does. Yes.
Okay, perfect. Are lifetime reserve part of QMB?
Absolutely. So for a hospital using those lifetime reserve days, yes, they're part of QMB as well.
Next question is, for non-medically necessary ambulance transport, are we able to bill a QMB eligible patient, or does an ABN need to be signed?
So an ABN is a Medicare term, and I will tell you that for a not medically necessary ambulance transport, you're following section 1861S7, which means an ABN does not need to be signed. Now, what your state Medicaid agency will and will not pay are two other items, because there are times when they will pick up those transports. So I can't answer whether or not you're able to bill the QMB. In most cases, the answer is yes, you want to bill it, and then they'll decide what they can and cannot pay, because their benefit package is different for ambulance than is Medicare. Next.
And then the last question I have in queue right now is a follow-up from Kathy's earlier question. And she said, I guess I don't know why a patient would take the initiative to get that off their file, since listing them as QMB prevents providers from billing them balances.
We can't answer that. I don't know why a patient would or would not do that. What I do know is that if they don't take it off the file and later it gets taken off the file, all of a sudden they can have huge balances that are due because it's now showing that it was their liability at the time, and the claims can actually be removed from the QMB status. So I don't know why they would or would not do that. That's not something we can answer.
All right. And then the next question that came in was off of a clarification to the one, how can I know whether Medicaid has paid the QMB Part B deductible? And Mary wanted to, state that a different way. Does Medicaid pay Part B deductible for QMB patients, or is there simply no deductible for them?
From Medicare, there will always be a deductible. Whether or not you can bill the patient for that deductible is what the QMB will do. Sometimes the QMB will pay it, and other times they will have you write it off. That's not something we can determine which one they're going to do, because we don't know how they process at Medicaid. But we can tell you that Medicare will always assign a patient deductible. Is that it?
All right. And that is the last of the questions in the queue at this time.
Okay, we'll do some pre-submitted stuff then. If Medicaid becomes a spend down, which is a different form of Medicaid than the QMB, why does it still show a QMB when they have no benefits until the spend down is met? We don't know that. We can't update that at all. I wish this was one, again, it's one of those where we would have to have it removed and we'd have to look at it, but we don't do that. So if you're billing non-medically necessary ambulance transports, oh, we already answered that one, sorry. What's the process for when patient has an out-of-state Medicaid plan that you are not enrolled with? Can you bill the patient? And are you obligated to write out that out-of-state Medicaid plans? So first, you'll need to contact that state Medicaid plan and see what they want. Medicare requires you to bill for the service, but you're not allowed but we are not allowed to comment on a Medicaid agency and whether or not they can require you to bill or what they need to do. Keep in mind, the Social Security Act does state that as long as a patient has this program, it can waive the following information. So to go back to that Social Security Act, we've already cited the section in the area you need. If the patient is QMB, does the Medicaid plan pay the coinsurance? Or isn't it actually going to wind up being a contractual obligation? We can't answer that. In some cases, yes, they'll pay it. And in other cases, no, it's going to be contractual obligation. It's really based on their fee schedule and their payment allowed amounts. So they may say, hey, we're going to pay a portion of it, not all of it. In some situations, they say, nope, we're going to waive it all. And in other situations, they say, no, we're going to pay it all. We don't have any answer for that because it's based on their payment methodologies. Next one is for ophthalmology, can we bill refractions if we have a signed waiver? So I'll tell you from a Medicaid standpoint, a refraction is not something that requires a waiver. This is an excluded service, which means under the law, it's never going to be paid. So we don't require a waiver for it. Can you bill this refraction? Sure you can. By billing that code, and we know it's not covered under Medicare, that's how we're going to send you the information. Probably a PR responsibility or a patient responsibility, and then say, hey, but don't bill yet, right? Check it out, bill Medicaid, and go through that process for the QMB stuff. Whether the state covers it or not, we don't know that. So again, there's some coverage guidelines for each state, and each one has to be followed. And then whether or not within that state, and it doesn't meet the coverage guidelines you're allowed to bill, that's a whole separate issue because it is something based in the Medicaid process. Can you actually bill a patient if it shows QMB but Medicaid is inactive? And the answer is yes. If the QMB is no longer applies, then yes, you can bill the patient for that service because obviously the QMB is not going to pick that up. The issue comes in when it's updated and suddenly the QMB does now reapply and you have to get the money back and you have to go through a variety of steps. So from our standpoint, if we leave you a patient liability and you know the QMB doesn't apply and you're looking through it, you have all that information, you want to make sure that you get it updated somehow, but as long as you have the information, we also, you can bill, but you also want to make sure to contact a legal representative and make sure you follow your Medicaid laws as well. One of them may prohibit until updates. We don't know that. Again, we're not involved in the Medicaid portion of it. If a QMB beneficiary is financially responsible for coinsurances and copays, and like we said, in most cases with a QMB program, the answer is going to be no. It actually waives those responsibilities. That's the point of the QMB program. Do QMB beneficiaries have a financial liability to pay on a portion of the claim? Why does Medicaid cover the why doesn't Medicaid cover the coinsurance and deductible? And the answer is typically Medicaid is covering the coinsurance and deductible. However, based on their fees, they may be making you write it off. That is not something that we have any control over. It's really based in their own amounts. So they may look at it and have to process it based on that type of information. So the QMB program doesn't ensure a payment. However, it does look at not having the patient pay you additional information. So that's what the Social Security Act states. It's not necessarily that you're going to get paid for the following. So remember, we have to use our magic payment formula, they have to use their magic payment formula, and then they coordinate out underneath the other payment formula. So you guys get that? There's a lot of different payment formulas happening there. All right, in the meantime, Mary Sue, did we get any questions submitted?
Hi, Tom. No further questions at this time.
All right, I'm going to go ahead and go on. So I want to remind everybody that in just a little while, a couple of minutes here, you're going to get an email. The email will be a follow-up email to this class. It does have a certificate of achievement attached on the bottom of it, and you can see it's highlighted here in the bottom red box. What's important is that this email will have contact hours. Those contact hours can be translated to CEUs, but a governing body has to issue the CEUs. We do not do that. So hopefully that answers your question. We do want to hear what you think of this education, so we will ask for your opinion. That's going to be the top red box. We're going to talk more about the survey in just a few moments, however. Remember, you can submit follow-up questions for 7 days following this topic. We will email the responses back. The key thing with these follow-up questions is they cannot be claims related. We have very little information on that. Also, if it's something that Medicaid must handle, that's going to be our response. You've heard me say that a lot when it comes to QMB. A lot of times people actually give me lower surveys saying, hey, he didn't answer these questions. And the answer is we're not Medicaid and we can't follow through and tell you what Medicaid is going to do with anything. We can only tell you what Medicare will do and what Medicare considers when it goes with this program. But again, we will take questions. Please complete the survey. The survey can be done now. Mary Sue's going to put a link in the chat. The survey can be done as we close out. It's going to give you a little box and it's called an external site that will be available to you. It's going to look like kind of the center bottom box here. You see a little orange triangle, CMS, MAC, Fed, RAMP, which is part of the destination address. This is not like a spam or anything like that. It is our survey, so please take that. By clicking continue, it'll take you to the survey. Go ahead and take it. If you're watching this in an encore presentation, which is available to you, we're going to give you online survey picture. It's going to look just like what's here in the upper left corner. And again, feel free to take the survey there too. Give us as much feedback as you can. Please remember to include what you liked, what you didn't like. Did you like the resources? Any type of information like that. With that said, that brings me to a close for today. So thanks for listening. Thanks for your time. I will encourage you again, take that survey, give me what you like, what you didn't like, anything you want me to know about it. Also remember to include topics for education. They do not have to relate to QMB. We would like to just know what you're looking for in general and what we can do to help you. You can sign up for additional webinars on our live events page and download that material that we talked about. So it's important to take a look at that. Please remember that we do update that once a week, typically done on a Monday. So do take a look at that, sometimes done on a Tuesday if that's the first business day. So on behalf of myself, Mary Sue, and all of WPS, thanks for your participation. We hope that you got something out of this today. We look forward to your survey comments, and we hope that you'll join us again in the future. You may now disconnect.